Good morning, everybody. My name is Inga Cotton, and these are Charter Moms Chats. And I today we have two special guests. So the topic today is the need to donate blood, even like in spite of and especially because of COVID-19. So the situation we're in is that so many events have been canceled, and it's including a lot of blood drives, and yet we're in a public health emergency, and a lot of people are having to go to the hospital. So the need is very great, but the supply is interrupted. So we have two guests to talk about their experiences and share some knowledge with us. So let's see, let me just so you can see their names properly. Okay, so our first guest is Tiffany Kieschnick-Rivas, and she so blood donations saved her life, and she has a really incredible story about how that happened. So the first part of our show today is going to be talking to Tiffany and listening to her story, and then we're going to talk to Dr. G, Dr. Samantha Gomez Ngamsuntikul, right? Did I get it?
Yeah.
Okay.
Yeah.
Good. Okay. Wonderful. Okay, but I'm going to call her Dr. G during the show. And so let's see. Her title is Associate Medical Director at BioBridge Global, and the South Texas Blood and Tissue Center is part of BioBridge Global. And actually, here's their website, so which is a great source of information. So Dr. G is going to give us a lot of factual information about the need for blood donation, about how it's safe to donate blood, about changes to the rules so that people like me can donate blood again, like I used to back when I was in college. And if we have time, we're going to talk about convalescent plasma and how that helps people who are recovering from COVID. So, Tiffany, I really want to hear your story and have you share that with our listeners. So I'm going to give you the screen here. Okay, so so what is let's see. There's an organization, let's see, Brothers in Arms. So tell us about that and tell us about your story.
Sure. So Brothers in Arms is a program that you can donate whole blood to, and it's actually only men who can donate, and it's men with O negative blood with low titer. So it's very specific, but I got whole blood, and I'll tell you how that happened. So January 2019, I was in a very terrible car accident. So I was at home with my kids. It was around 4:20 in the afternoon, and my little son asked me for an icy, and so I told him, sure, I'll go get you an icy. So I ran to the gas station, which is not far from my house, and I got the icy, and everything seemed fine, just like a normal day. And I get the ices, and I get back in my vehicle, put my seatbelt on, and I put my car on cruise control because it's a country road over here off of Gulm. And I'm driving down the road, and I passed out from a stroke. Fortunately, I pulled my car to the right because it was two-way traffic, so just two lanes. And I pulled my car to the right. I hit a mailbox and then two guardrails, which sent my car into a flip. Wow. And there's a ditch over on Gulm Road that I ended up landing in. And my car landed on its passenger side. The window landed, there's like these concrete bricks that are there so debris doesn't go through. And I happened to land right on that.
Wow. Wow.
And two teenage boys actually got to my car first. They were from Harlan High School, and they got down there and they were screaming for help. And some other folks had stopped. They were on the bridge, and they kept telling the boys to let me go, that I had already passed on. And they're like, no, we hear her, so come help us.
Wow.
So there was an Army sergeant that happened to be driving by, and she heard them. She stopped her truck in the middle of the street, jumped out, ran down the hill because it's kind of a steep hill to get into the ditch. And they flung my driver's side door open, and she just jumped in. And thankfully she did, because I was actually drowning in what little bit of water was in the ditch. There wasn't a lot, but enough that my head was in there and I was drowning. So she got in there and held my head out of the water, and they were trying to talk to me, make sure I could try to stay, with it. And until paramedics got there. And then when paramedics got there, they were going to try to use the jaws of life to get me out. And unfortunately, Um, I ended up crashing in my car, so they couldn't use the jaws of life to get me out. Once I stopped responding, they knew that at that point they just needed to get me out ASAP. So they broke out my back window of my car, put the stretcher in, and just pulled me out. At that point, it didn't matter if any more damage was done. I was already gone at that point. If you can picture, so I had my seatbelt on, and in the flips, I unbuckled my own seatbelt and landed in the passenger side backwards, upside down in a C. So my feet were on my dashboard. So it was kind of a crazy position, they said.
Yeah, wow.
So once they get me out of the car, they took me up to the ambulance and they hooked up the machine to do CPR. And then they hooked me up with whole blood. And it takes roughly about 3 minutes for the whole blood to cycle in. And they said, as soon as that whole blood finished, I woke up. And I actually scared the paramedics. The paramedics said if anybody had been looking into the back of their unit, that they would have thought they were brand new because they were not expecting me to wake up. So I woke up and, I tried to talk to them and I was trying to move around. So they put me back to sleep. So I got 1 unit of whole blood on the ambulance, which is what actually saved my life. I had lacerated my spleen in the car accident. So I was bleeding out. And then they transported me from the ambulance to the helicopter, and I ended up getting 2 more units of blood on the helicopter and 1 when I got to university.
Wow.
Yeah. So
I'm picturing like they know what condition you're in, and then the fact that you actually woke up like in the ambulance. I just imagine like their reactions. Like it must have been.
Yeah. They said that I was the first traumatic survivor to survive from whole blood transfusion. And the doctors told me, you really had a 0% chance of survival if we hadn't had whole blood on the ambulance. So it's pretty incredible that, that they were able to make it there. There is quite a few ambulances on site. Excuse me. Quite a few ambulances there. And, just one of them. And there was only 6 at the time in San Antonio that actually carried whole blood. So for them to be able to have made it to me was pretty incredible. Everything lined up for me that day, for sure.
Yeah. Wow. That's a really incredible story. So what message do you have for like people who, could donate blood, but just haven't taken the time to do it, or is there anything special about the blood that you received, right? And what that has to do with Brothers in Arms?
Yeah. So Brothers in Arms is a program that, gentlemen can donate, and you have to have O negative, low titer blood. But I encourage anyone, if you haven't tried to become a Brothers in Arms, to go to South Texas Blood and Tissue Center, make a donation. They will test your blood for that. And, potentially you can become a Brothers in Arms. And that's the blood that they use for the whole blood program. But in general, if you have the capacity to go donate, please, you could be saving someone's life. I know my blood donor jokes around about it all the time and tells me, I just go for the juice and cookies. But, I told him, well, I'm glad you went for the juice and cookies because he truly saved my life. And you could be saving someone's life too. Something so small can make such a huge impact in someone else's life.
Yeah. That's Tiffany, your story is just incredible. And I think when people, it brings it to life. I mean, here you are. And, if it weren't for the generosity of that donor, if it weren't for like all those steps, right? Like the trained paramedic and like the fact that they had whole blood, ready to help you, it took all right. And like the teenagers from Harlan High School, who found you and weren't giving up on you, right? The Good Samaritan who held your head up out of the water, right? I mean, it takes so many steps in the chain, and here you are, and I'm really thankful for that.
Me too. Thank you.
Yeah, and thankful that you take the time to share your story, so that it can make an impression on people like me and like our readers and listeners, who may have the capacity to donate blood but haven't taken the time to do it, or and they may have concerns about the current situation. So, Tiffany, I don't want to cut you off, but is there more about your story that you want to share, or do you think we should transition to Dr. D?
The only thing that I wanted to say is I know you mentioned the FDA guidelines and changing. I think being Military City USA here in San Antonio, not a lot of people have heard that if when you were in Germany during a certain period of time, you can donate again. Myself and my parents, we went July 1st and we tried to donate also, or we did donate also. So just getting that message out there is important because I think you'll see a lot more donors from San Antonio knowing that guideline has changed.
Yeah, there are a lot of people here who have lived overseas, and
Yeah.
the rules have changed. Okay, so Tiffany, I'm going to bring you back in towards the end of the show, so stay logged in. But
Okay.
we're gonna focus on Dr. G and her sharing facts about blood donation. First, Dr. G, can you talk about like the current situation, right? That so many events have been canceled over the last few months, and yet we're in a public health emergency, so there's a great need for blood. So what's the current situation?
Yeah, COVID has had an impact like in every other industry, right, in the world. And for us, we had a number of blood drives canceled, over 200, which is about 7,000 units of blood, which is a huge impact to our center, right? Because even though the donors aren't coming in, patients still need the blood. Patients who have cancer or, God forbid, get in a traumatic incident like Tiffany did. So we always have that need for blood. And we are constantly going to the community to please come and donate because that need is a constant need for blood.
Yeah. One thing I wanted to ask you about is the safety of donors when they do come. So let's see, I'll bring up the website again, right? So the procedure for, like, I hope that people listening to this feel energized and they will go to the website. The link is also in the description of the video, but they can go to South Texas Blood. They can make an appointment, right? So it's not, right? I mean, I think when there were events, it's like, oh, it could be at your workplace and you could just, walk in on your break, and, it was more spontaneous. These days, because of COVID, everything has to be pre-planned, everything has to have an appointment, and everything's spread out. But, but at the donor pavilion, they're taking steps to make sure that donors are safe, right?
Correct, right. Because donor safety is so very important to us. We now only take donations by appointment only. And that's a huge change because in the past, you could just walk in and we set you up with a donation. And now to ensure social distancing, we only take donations by appointment only. And we've also done a lot of other measures to ensure the safety of our donors. And you can go to the website, southtexasblood.org, with a whole list of everything that we've done because we want to make sure that donors feel safe when they come and donate, because we do have that need for blood. We want to make sure our donors are safe when they come in.
Right. Everything we do, during COVID, it's always a trade-off, right? It's like, it's like, well, we need food, so we need to go to the grocery store, so how do we make that safe, right? It's like you wear masks, you use the hand sanitizer, you stay spread out from other people while you're waiting in line, so like we have to keep living our lives, and this is something where it's for the public good, right? Because you can save lives of people like Tiffany.
Correct. And in addition, we're also doing temperature screening as people walk in the door. So we have a series of questions that we ask all of our donors and our employees too, and anyone who comes into our main building, a series of questions and take a temperature. And we also make sure that everyone has a mask on.
Yeah.
But I agree. I mean, you listen to Tiffany's story and it's important, the need for blood.
Yeah. And the need continues. Yeah. Has there been an increased demand in the need for blood, or is it pretty stable compared to pre-COVID?
It's really been spiking. We've had increases, and then with the cancellation of elective surgeries, the blood usage dipped, but now we're seeing an increase because people are out and about, trying to live their lives, going places, and, things happen. And so the demand for blood is still there. And then you have cancer patients who need blood all of the time, regardless of it's COVID or not.
Right. Exactly. Yeah. Life keeps happening. I've been out on the roads occasionally, and traffic is not that different than what it was before. So yeah, people are out there. So I wanted to ask you about the change in the FDA guidelines, because there are people like me who, like, I used to donate, like in the 1990s when I was in college, I would donate blood as often as I could, but then the rules changed, and so I lived in Germany in the late 80s because my dad was working as a civilian for the army, and so I found out, like, oh, I can't donate blood anymore. But now the rules have changed, and I can donate blood, and I pledged that I will, as soon as we get off this call, I will go make an appointment, and then I can be a blood donor again. But so what happened, and what changed, and who's now eligible again?
Yeah, so starting July 1st, there are a lot of changes that allowed a lot more people to be able to donate. And that included military members and their dependents who lived in places in Europe, like Germany, for example, and Belgium, who are now able to donate, who previously couldn't. And then there are some additional changes regarding travel to areas with endemic malaria and some other changes. And I would just tell people, if you've been deferred in our system because you lived in Europe, to please reach out to us to get you reinstated. And if you've never donated because you always thought you're ineligible because you lived in Germany as military dependent, for example, again, just please reach out to us, make an appointment, because we want to be able to bring those donors in to be able to help the community.
Yeah, I think one thing about military families is, the sense of community and teamwork, and like everybody having to pitch in, and so that's a community of people who want to give back, and and so to be able to accept donations from military families again is going to be great for the supply.
I agree. And I will say, so Tiffany mentioned the Brothers in Arms program, and that's a really, really special program and a really special set of donors. The donors are male O-positive donors who donate whole blood that gets placed on those helicopters or in that ambulance. And I will say, throughout everything with COVID, those donors continually show up. And I think it's because they see what's happened with Tiffany and the lives that it saved, and they make every effort to donate blood.
Yeah. So I'm not O negative, but I'm O positive. So hopefully that is a fairly versatile type of blood. So
right. And so low titer O, it's O positive blood for the whole blood. And so to be in the Brothers in Arms program, you have to be an O positive blood donor.
Yeah. Yeah. Okay. And male, which I don't qualify for, but that's okay.
Yes, male. Right.
Let's see. So let's see. I want to be sure and ask about, okay, so one of the things that's interesting about during the COVID era is that people who have had coronavirus and recovered from it, that there's a way actually for them to help people who currently have coronavirus. So how does that work, and how can COVID survivors go to the South Texas Blood Infusion Center to give back?
Yeah, this is actually a really great program too. So convalescent plasma is plasma from patients who've recovered from COVID, right? And so plasma is the liquid part of your blood. And so that can help severely ill patients in the hospital who are currently fighting COVID. So to those people who've recovered from COVID, if you're looking for ways to give back, please reach out to us. We have either the website that you can reach out through, or you can email covid19@southtexasblood.org to get more information on donating convalescent plasma. But that, of course, is always a need, especially with the cases in this country going up.
Yeah, that's something where, I mean, I think for anyone who's had coronavirus, it's I know some people don't really feel it, but some people feel very, very sick, and then once they've recovered, I imagine that it would be a good feeling to know that their blood could actually help save other people's lives, or not so, but their plasma. And I guess plasma is something that people can donate more often than blood, right?
Correct. Yeah, the process is a little different. So with a whole blood donation, which is typically what people donate, we're essentially just putting a needle in your arm and taking a bag of blood, right? And then in the manufacturing lab, we separate it into different components. Mm-hmm. But with plasma, whenever you donate plasma, you get hooked up to this machine that centrifuges your blood and only takes the plasma. It gives you back your red cells and your platelets. So you can donate every 4 days. And so some people feel better because it's only your plasma that it's taking out, not your red cells and your platelets.
Right.
But I will say the donors who donate convalescent plasma are incredibly dedicated donors as well. We have donors who, like you said, they were sick and now they want to give back and help. And that way to help is through donating convalescent plasma.
Yeah. Wow, that's wonderful. So I want to bring Tiffany back into the conversation, but Dr. G, are there more like facts about blood donation, or like what steps people should take that you want to share?
I think if people have questions, I get that, that question a lot, like, well, I can't donate, or I don't think I can donate. Just reach out to us. I mean, a lot of things have changed, particularly July 1st with military. Just please reach out and see if you're eligible, because you likely are.
Yeah, yeah. Well, wonderful. Okay, I'm gonna bring Tiffany back into the stream. So are there are there just more messages you want to share with people? Are there any like sort of what are like typical questions that get Tiffany? Are there questions that people ask you when they hear your story?
Um, they ask me all the time how the whole blood saved my life, and I thought they did blood transfusions all the time. And what the key was is that yes, of course, they've done blood transfusions all the time, but it's on an ambulance. And, San Antonio being one of the only cities, I mean, there's more now, but at that time, one of the only cities that had whole blood on an ambulance. And that is the key, is that they're able to get to you much faster and get you the help you need much quicker.
Yeah, that having it on the ambulance ready was
Yeah.
the difference maker in your situation.
Yeah, exactly.
I still think like what the looks on their faces must have been on the EMTs when you woke up.
Yeah,
that was something.
They become kind of like my family, the paramedics and everyone. So we talk often. Obviously, with COVID, we haven't been able to see each other, but prior to that, we'd have dinner or meet up every once in a while. So it's been nice.
Yeah, yeah, and the fact that you know the donor, that's incredible. Yeah, you do. Yeah. Yeah, that's amazing. Okay, well, I pledge that I'm gonna go on the website and make an appointment. Since as of July 1, I'm eligible again, so I'm really happy about that. And I hope that my readers. I think one thing I'm proud of. So this is the link for the San Antonio Charter Moms discussion group on Facebook. We have almost 7,000 members, and it's a very community-minded group of people. So, I mean, lately we've been talking a lot about education, but I think everybody in the group shares a commitment to, taking care of each other and making things better in our community. And so I hope that, some of our members will also, like me, make an appointment and sign up to donate blood soon, because the numbers that Dr. G shared are very dramatic about, the gap, how many fewer blood donations have happened recently because of all the events that got canceled. And yet the need continues, right? Like Dr. G said, there's cancer patients who still need donations. There's, trauma and accidents that are still happening, and those people need our help. So, okay, well, Dr. G, is there any kind of closing thoughts you want to share with our listeners?
Yeah, I just want to say thank you for having me on the show. And again, to everyone out there, a great way to give back is by donating blood. We have some really incredible things that we're doing to help our community, and that includes the Brothers in Arms, I think, which is a really special program, and of course, our convalescent plasma. But even if you're not a male or you've not had COVID, there's still ways to give back. You can still save a number of lives and get some great cookies and juice.
That's great. I'm definitely looking forward to the cookies and juice. and Tiffany, I'm so glad that you're here on Earth, and I'm so glad you're here on this show to share your story with us. It's really incredible. So, do you have any closing thoughts that you want to share with our listeners?
No, just again, thank you for having me. And if you can donate, go donate.
Yeah, we will. Okay, all right. Well, thank you so much for being on Charter Moms Chats, and I wish you the best.
Thank you.
Thank you.